Good afternoon and welcome to this informative session of the European Diploma in Radiology. It is an honor for me to be here with all the different members of the Brazilian Society of Radiology. I'm Laura Oleaga. I'm a neuroradiologist based in Barcelona in Spain, and I'm the scientific director of the European Diploma in Radiology. And I'm very proud and honored to share this session with all these Brazilian professors that are going to be now in the session. First is Professor Saparoli, please.
Okay, so good afternoon, everyone. It's a pleasure to be here in another informative session for the third edition of the EDiR test in Brazil. So I'm Mauricio Zaparoli, abdominal radiologist from Curitiba and currently scientific director for CBR.
Hi, everyone. I'm Ronaldo Baroni. I'm an abdominal radiologist based in São Paulo, Brazil. I'm currently the Director for International Affairs of the Brazilian College of Radiology and a professor of radiology at Albert Einstein Medical School. We value a lot at the Brazilian College of Radiology the partnership with the European Society of Radiology on a broad basis, and one of the activities that we value a lot is the European Diploma in Radiology. So CBR is the only provider of the diploma in Brazil that currently takes place in the first day of the Brazilian Congress of Radiology.
Hello, everyone. I'm Breno Matos, neuroradiologist, teaching assistant, professor, and researcher at the Albert Einstein Hospital in São Paulo. I'm also a ED holder.
Good afternoon, everyone. My name is Gustavo. I'm a neuroradiologist in Curitiba. I work with Dr. Zaparoli in Clínica DAP. I'm also an EDiR holder, and it's a pleasure to be here.
Hello, everyone. My name is Simon Bardot. I'm a Brazilian radiologist, trained in Brazil and moved recently to London. Currently, I'm a senior clinical fellow at King's College Hospital, NHS Foundation Trust, and I've had EDiR since 2019. I took it in Vienna before it started being done in Brazil.
Okay, thank you very much, and thank you for participating in this session. So we are very proud and honored to have the EDiR holders that Brazilian radiologists that already took the examination. And so this is the European Diploma in Radiology is one of Europe's most prestigious medical examinations. And right now we have over 5,000 EDiR holders. More than 1,000 candidates take the examination annually. We have organized more than 200 examinations since we started with the diploma in 2011. And we have a self-developed examination and platform with credential services developed by our IT group based here in Barcelona. And the European Diploma in Radiology is endorsed by the UMS, and it is SESMA accredited that this is the agency that is in charge of all the accreditations of medical diplomas in Europe, and it is endorsed as well by the European Society of Radiology. And so this is the European Diploma in Radiology. Has an international recognition, and the EDiR holders can use their certificate for professional credentialing and classification purposes. And there is an increasing number of European hospitals that have incorporated the EDiR into their training programs. And this demonstrates the value and of this standardized type of examination to check the radiological excellence, and it is the European Diploma in Radiology is based on the European training curriculum. And right now it has national board equivalencies, is equivalent to the Polish National Board examination, to the Dutch National Board examination, to the written part of the Croatian and the Slovenian board examination, and also to the image interpretation section of the Finnish national examination, and to the Flemish board examination. So as you can see, in Europe, it has a lot of value, and it has equivalencies with their national board examinations. And it has significant value in different countries like Italy, France, Malta, and right now also in Sweden. And it has a professional recognition by the Indian Radiological and Imaging Association and the Pakistan Medical Commission, and we organize every year examinations in India and Pakistan, as well as in all different countries in Europe. And this is the structure of the examination. There are 3 parts. The first part are the multiple response questions. This is a session that takes 95 minutes, and I will present some examples of these MRQs. And after this first session, there is a short break with a second second section that are the showcases, that are images and with questions related to those images that takes 90 minutes, and followed by the third part that are the clinically oriented reason evaluation part that includes 10 clinical cases. These are complete cases in a DICOM format, and the candidates have to go over the cases similarly as they do the reports in the workstations in the hospitals. In this part, there is a free text part. They have to report on the images they are going over, and I will show one examples on how to go over these clinical oriented reasoning evaluation cases. There are 10 clinical cases from the different clinical subspecialties in radiology. And the knowledge base for the examination is the European Training Curriculum for Radiology, Level 1 and Level 2. And in the webpage of the European Board of Radiology, you can find a lot of educational resources to prepare for the examination. The EDiR simulation, that these are mini examinations with the 3 parts, and the candidate, the attendees that take this EDiR simulation, they get a report on how they have done in the different areas, so they can reinforce the areas in which they see some weaknesses. There are also we have the EDiR mobile application, in which you can download a self-assessment test. Also this year it was we launched the second edition of the EDiR, the Essential Guide, that is an electronic book organized exactly as it is organized the examination in the different clinical and non-clinical parts of the examination that are included in the European training curriculum. And then the EDiR training evaluation, that this is a free test that you can take, includes 125 self-assessment tests, and you can go over this test in the webpage of the European Board of Radiology, or also if you go to the European training curriculum, at the end of the European training curriculum, there is a link in which you can access to this EDiR training evaluation, in which you can do a self-assessment test. There are 125 MRQs you can go over. And this is the evolution of the Brazilian candidates, and we hope in the future we will have more Brazilian candidates taking the examination. We started with our collaboration in 2015, And now in 2023, we had 16 candidates, Brazilian candidates, and 2024, 11 candidates. And so the number of candidates in 23 and 24 has increased because at the time we organized locally the examination at your national congress, as we are going to do this year. And these are the eligibility criteria. So the knowledge, as I already mentioned, base for the examination is defined in the European training curriculum, and the candidates must be certified radiology with a 5 years training program. And the total years of training and supervised practical experience must be 4 or more at the time of the application. And these are the documents required for the admission to the examination. The candidates must be active members of the Colegio Brasileiro de Radiologia, and all this information is in the webpage of the European Board of Radiology. So you can go over all these eligibility criteria if you want to apply for the examination. And this is the date of the examination. This year is going to be in September, the 18th of September in Curitiba. Is the time of your National Radiological Congress. And there are special offers that you can also find in the information in the European Board of Radiology for early registration, and for late registration, the application is closes the 16th of July. So all this information is available in the European Board of Radiology. So there are some special offers for early registrations. And now I'm going to just present you exactly how the examination is organized, and I'm going to show you some examples of the 3 different parts of the examination, just to give you a flavor of how the exam is organized and the type of questions we ask the candidates. So this is the MRQ, the one example of an MRQ. And in these MRQs, under the heading of the question, it is defined if there are one or multiple answers that can be correct. So in this case, regarding percutaneous treatment for aortic aneurysm, which of the following statements are correct? And so this is, there are 5 different options. And in this case, more than one option can be correct. So you have to select any of the options that you consider that are correct. Since there are more than one option that can be correct, depending on the number of the answers that correctly are selected by the candidate, we apply a formula to score that question. There are no negative points, so either you can have 0 or 1, or something between 0 and 1, depending on the number of answers that you have correctly selected. So in this case, the correct answers are, these are the correct answers. The length of the infrarenal neck of the abdominal aortic aneurysm should be at least 1 to 1.5 centimeters in order to be able to perform the EDiR. And so this adequate neck length is essential for properly performing the surgery. And the other answer that is correct is 30-day mortality after EDiR is lower than 30-day mortality after open repair of an abdominal aortic aneurysm. The other 3 answers were incorrect. So if you correctly select these 2 answers, you will get 1 point. If you only selected one correct answer and the one incorrect answer, then we apply a formula to calculate the scoring. And now we are going to go to the second part, that these are the short cases. In the short cases, usually we present an image with some clinical information, and the candidates have to go over the clinical information. The clinical data are very important in order to make the correct diagnosis. So this is a 26-year-old woman with a previous history. The previous history is unremarkable, so she doesn't have any diseases, and she's a young woman, and she has pain in the sinuses, especially in the left side, and she has been taking antibiotics for 3 months, but she persists with the pain in the sinuses, and this is the CT of the sinuses with low dose. And usually in the short cases, we present this image, and then we ask the candidates to indicate where is the abnormality located. So the candidates have to select with the cursor the area in which they consider that the abnormality is located. And so in this question, the score would be 1 if the candidate correctly select the area of abnormality, or 0 if the selection of the abnormality is incorrect. And then the next question, and then we provide with more images. So these are CT and MR images with contrast. And the first image on the left is an axial CT image with contrast. The second one is the sagittal with a soft tissue window, the sagittal CT with a bone window, and then the T2 weighted MR image in the axial plane, and the coronal and sagittal T1 weighted with contrast and fat saturation of the same region. So here what we can see that there is a discontinuity of the anterior skull base on the left side, with associated opacification of the ethmoid sinuses, and on the MR image we can see that the ethmoid and sphenoid sinuses are occupied by secretions that demonstrate high signal intensity on T2 weighted images, and heterogeneous enhancement. And again, we can see the discontinuity of the bone, especially on the bone window of the CT in the anterior skull base. So next, please. So this is an explanation I'm giving, but usually the candidates, the only thing they have to do is just check the images and then answer the questions. So this is the CT and MR with contrast were performed, and now we are asking the candidates to decide what is the most likely diagnosis. In this case, only one option is correct because we are asking for the most likely diagnosis. So again, the candidates here, they only have to select one option, and the score would be 1 or 0, depending on if the candidate has correctly selected the correct answer. So in this case, the correct answer is a complicated fungal sinusitis. This was a young woman with no prior history or of any diseases previously, and so the bony erosions and discontinuity of the skull base can occur in fungal sinusitis. We don't see any sinus expansion or a mass to consider the possibility of squamous cell carcinoma or esthesioneuroblastoma. And in sinonasal granulomatosis, we don't, it's a 26-year-old woman with any other diseases. And in chronic ethmoiditis or sphenoiditis, usually you don't see this bone destruction. So now the next question is regarding this fungal sinusitis. Which of the following statements are correct about this condition? So there are 5 options, and here more than one answer can be correct. So the candidates have to decide between these 5 different options which ones are correct regarding this condition of fungal chronic sinusitis. So in this case, the options that are correct are the low T2 signal in fungal sinusitis can show low signal intensity due to these paramagnetic elements like iron, manganese, and magnesium that can be associated to fungal sinusitis. And inspissated secretions can mimic sometimes this condition and predominantly affects immunocompromised patients. And antibiotics is not the choice of treatment, and the disease does not spread to the lungs, so these are not correct answers. So in this case, there are 3 correct answers that the candidates might have to select in order to get 1 point. And if they don't select the 3 options that are correct, then we apply this formula to calculate the score. And the third part is the clinically oriented cases. I'm going to show only images, but in the real examination, the candidates will see a complete case. I'm going to present selected images, but just for the session, but in the real examination, the candidates will see the complete case and all the images of this patient, similarly to the cases we see every day in the hospital. So this is a 56-year-old male. He was a previous smoker and history of stroke 4 years before. And the ECG was that was studied for a ECG anomaly, and he doesn't have any family history of heart disease. And I selected some images. So this is the 4-chamber and the 2-chamber views of T2 weighted images of the heart. In the real examination, in these cases, for example, in cardiac images, we include also videos of the cases, just to see the motility or anything we consider that is important to go over the case. So now you have to pay attention to the images, and this is the short axis view, in which we can see the left and the right ventricle, and you have to pay attention to the left ventricle and the thickness of the left ventricle and the trabeculation of the muscle in the left ventricle. And this is a late gadolinium enhancement inversion recovery series. And here we have to check for areas of late gadolinium enhancement, because some of the questions are going to be related to these findings. So here we don't see any late gadolinium enhancement areas. So this is the first question: what are the most relevant features on this and the location in these images? So this is usually in the core cases, the first question is a free text question. So you have to report or do a short report, like a structured report of what you are seeing on the images. And so in this case, what we see is excessive trabeculation in the left ventricle, left ventricular dilation, and anterior and lateral and mid apical segments of the left ventricle are involved. So here we are asking for the features and the location of the features. And this is very important to make the diagnosis. But usually the first question is just a report or a description of what you are seeing on the images in order to make the correct diagnosis. It's like a structured report of the images. And then there is a question about these findings. So according to the MR findings, which of is the most probable diagnosis. Again, here there are 4 options, and here only one option is correct. And so the diagnosis is excessive trabeculation in the left ventricle. This is the hallmark of the left ventricular non-compaction cardiomyopathy, and the myocardium appears like a spongy with non-compacted appearance due to abnormal embryologic development. And the location of this abnormality is more typical in the apical and mid-ventricular segments. And the other options, apical hypertrophic cardiomyopathy, usually is located, is thickening in the apex of the myocardium. We don't see these trabeculations. Dilated cardiomyopathy involves the left ventricle, and there is dilation of the ventricle, but there are no specific segments that involve, and we don't see this spongy appearance of the myocardium. And then left ventricular thrombus, we didn't see any filling defect in the cavity of the ventricle. So the diagnosis in this case would be left ventricular non-compaction cardiomyopathy. And then here, this is a free text question. Do you think myocardial fibrosis is present or not? In the late gadolinium enhancement, in the images, we didn't see any abnormal enhancement of the myocardium. So here the correct answer would be no. There is no late gadolinium enhancement, so we don't think that myocardial fibrosis is present in this case. So this is the way we structure the examination with MRQs, short cases, and core cases. And so thank you very much. And this is the webpage of the European Board of Radiology, in which you can find all the information with all the educational material, and also all the information regarding how to register for the examination. And in case you have any questions, you can send us an email, and we will try to answer any of the questions or doubts you may have about the European diploma. And I hope that many candidates from Brazil will register for the examination during the Brazilian Congress of Radiology. And now I give the board to any of you in case you want to make any comments or ask any questions. And maybe the EDiR holders, they can explain us or explain the audience why they decided to take the EDiR examination, and if the EDiR examination helped them or give value to their curriculum.
Excellent. Thank you so much, Laura. But do you wanna maybe start and go around with the EDiR holders?
Yeah, sure. Thank you very much, Laura. Once again, good afternoon, good morning, depending on where you are. It's a pleasure to be a participant of this webinar, this presentation on the EDiR in Brazil. So that's again, it's going to be the 3rd year that we have an EDiR test being taken in Brazil during the Brazilian Congress of Radiology. So this is very important for us at CBR to have the opportunity to hold this during our meeting in Curitiba this year. So the test will be taken on the 18th of September, the first morning of the Brazilian Congress of Radiology. And it's important to certify everyone that's participating in this webinar that in Brazil, we value a lot. There's a lot of value attributed to this diploma. Even though it's not recognized as a board certification in Brazil, for professional purposes, it's very, very well recognized. So I work in a large institution, which is both academic and private. And for instance, we have more than one EDiR holders here in Albert Einstein Hospital. Breno Assunção, that is here with us, is one of them. So this is something that the clinics, the hospitals, the radiological groups in Brazil take a lot into account when hiring a radiologist or retaining a radiologist, or to promote radiologists all over Brazil and all over the world. Of course, if you are in Europe or if you intend to go to Europe, that's even more important because, as Professor Oleaga said, some countries value the diploma as a board certification. But even you're not intending to go to Europe, it's very useful to take this test as a proof of knowledge, as an add-on of knowledge to your curriculum. So for Brazilian radiologists, that's well recognized, even for Brazilian leaders. And at CBR, we take a lot into account when advertising this, and that it's important for us to be part of this initiative that's taken worldwide. And we, of course, we are the sole providers and partners of the European Board of Radiology and the European Diploma staff and group to do that in Brazil. So once again, I'd like to leave this message for everyone that's participating in this webinar. Get more information if you wish with us at CBR, with me or Mauricio, or you can contact any colleagues here that already took the exam, so you can get more familiar with it. So once again, thank you all for being here, and thank you, Professor Oleaga, to participate and have the opportunity, in giving the opportunity for us to participate on it. Mauricio.
Excellent. Thank you, Baroni. That was a great summary. I think I'll go around the EDiR holders now, and I'll start, go with maybe alphabetical order. So we start with Breno, just so you can maybe give us a quick idea of your experience taking the exam and how it was for you. Why did you take it? Just to give someone who's maybe thinking of taking the exam maybe some insights on how it can be useful for their lives. So I'll pass to you, Breno.
First of all, thanks CBR and ESR for the invitation. I'm glad to be here sharing my experience as a EDiR holder. EDiR added value to my curriculum and really improved recognition locally, nationally, and also internationally, and helped me advance my career at my work. It also expanded opportunities inside and outside the country. As you need to go through all the educational tools to pass the test, it also updated me, my radiological knowledge and skills, including uniformization of guidelines and protocols according to the best European radiological practices. And EDiR is a benchmark examination model that also helped me as a professor and teaching assistant. So some tips that helped me pass on the test is start studying 3-4 months before the test. Don't let to the last month to start studying for the test. Go through all the educational resource that Laura Oleaga told. Read the session guidebook. Take the self-assessments of the different testing types, MRQ, short case, and core case, to get familiarized with the examination sections and focusing on the areas that you have more difficult with, and do the EDiR simulation. It's like the closest experience to the real test. And also the duration of the test is short, so manage your time correctly and get a good night of sleep before the test. That's it.
Excellent. Thank you, Breno. Ernesto just pointed out something really important. We can now speak in Portuguese because our audience is Brazilian. And I know that Laura, Ernesto, and Cristina, they also understand a little bit. Então, vou passar para o português agora, antes de passar a palavra para a nossa próxima convidada. Então convido você, Carolina, peço para você se apresentar também, porque acabou não aparecendo o seu slide ali no início. Então, se você pudesse se apresentar e falar um pouquinho da tua experiência, por que que você fez a prova e como que foi isso para você.
Hello. First of all, it's an honor to be here, and I would like to thank Dr. Baroni for the excellent work he has done in Brazilian radiology. And I was his student in 2013 in the fourth year of the medical residence at the Albert Einstein Hospital. And I learned a lot about internal medicine with Dr. Baroni. And I choose to take the test to challenge myself as a good radiologist and to study again some topics that I need to refresh as I finish my residency in 2013. And also because it's a globally accepted and very well done test that covers all the topics that a good radiologist should know. I also took the test because in case it's necessary to move to another state or city, uh, they always ask for a resume and with all the validations. The tip that I give it that helped me a lot and is to buy the tools, the materials from the platform and work hard and study hard. And I would like to thank Dr. Breno Assunção Matos, who is here and who gave me tips on how to buy the materials as I contacted him on LinkedIn, and he kindly responded me a year before I took the test. Thank you, Dr. Breno Assunção. And I also to thank Dr. Ernesto and Dr. Zapparoli, who administered the test and welcomed me very well. And also that I'm available to help anyone who wants information and also at the disposal of the European Society of Radiology. Thank you so much.
Mauricio, you are muted.
Maurício, seu microfone.
Desculpem. Obrigado você, Carolina. Acho que uma outra coisa bem importante também que o Barão já colocou ali, que é essa possibilidade também de você fazer o teste sem ter que viajar para outro país, né? E tudo acho que é uma grande vantagem, né? O Simon não pegou isso ainda, né? Fez antes, mas para quem quer fazer agora, e a gente viu ali nos gráficos também da Laura como isso aumentou também o número de pessoas que puderam fazer o teste. Vou passar agora a palavra para o Gustavo. Gustavo também, mesma linha, que você achar aí que é importante aí para quem está pensando em fazer a prova.
Good afternoon, everyone. I would like to thank you. Thanks CBR and EDiR for the invitation to be here again. And thank you, Dr. Zapparoli, for all the help. And the topics I would like to share is quite similar to what Breno and Carolina said. As Professor Leaga said, it's a well-recognized certification. It's progressively more recognized in Europe, and as Professor Baroni said, in Brazil is the same. It's not a board exam, but is if you have to locate to another city, another clinic, another hospital, and even if they don't know exactly what it means, they just look for the exam for the European the name per se, the European Diploma of Radiology. It's a strong name, and obviously it's a certificate of quality. It's a proof of quality. So that's the main points why I pursued the exam. I have already thought of doing before, of going to Austria and doing the exam, but after in 2023, when the opportunity chose in Brazil, I promptly applied for the exam. So it was a very good opportunity to doing it in Brazil. And For the exam per se, it's an opportunity of self-assessment, as Carolina said. So but it also has some challenges. For example, as Breno we works more with neuroradiology, and there were several topics I have not been touched since my residence training. So I have to study a lot. So the tips I would say it's also to start early and review all the topics of radiology. You can use in several materials, but the mock exams and the EDiR simulation, I think it's essential. It's mandatory for to be in touch with what the text, how the text works. So I think it's very useful, and I think it was a very good experience also to review all these topics. There you can see even the subjects are usually to work every day. In my case, in radiology and head and neck imaging, looking for other subjects in radiology was also useful. So I can say that it helps. Our specialty is changing, so also other thing I have to say is that if you can be as qualified as possible, it's good. So in Brazil, even if you are not intend to move to Europe or to another country, even in Brazil, I say that's a very valuable certification you can get. But uh, my example for me, for example, I have no intent, at least for now, to moving out of Brazil. So uh, I think it's even for my career, for my professional daily practice, it was a very helpful experience. So I think that's the main topics. So I would like to thanks for the opportunity.
Excelente, Gustavo. Muito obrigado. Passar agora para o Simon. O Simon acho que vai dar uma perspectiva um pouquinho diferente. Acho que vai ser bem interessante a gente ter esse contraste de alguém que já está fora, né, Simon? Mas o Simon é
sim.
um amigo também aqui de Curitiba. Então, Simon, prazer ter você aqui. Deixo aí a palavra com você.
Eu que estou falando inglês o tempo inteiro, vou falar em português para treinar um pouquinho. Eu fiz esse exame então já há 6 anos. Eu fui a Viena. Não existiam os recursos que vocês mencionaram, que são mais recentes. Foi uma época que um colega convidou para irmos ao Congresso Europeu e havia uma vantagem de fazer o exame mais ou menos pelo mesmo valor da inscrição, era uma coisa, um estímulo. E eu me propus, eu já estava, acho que 13 anos de radiologia, né, Maurício? Mais ou menos, a gente estava, ou 15 anos. E eu falei, vai ser uma boa eu fazer esse autoteste para ver como é que a gente está. Eu acho importantíssimo, independente da subespecialidade que cada um pratica, tentar sempre manter o estudo de radiologia geral. Isso ajuda a carreira, não importa onde você estiver. Então, isso me ajudou muito. Eu sempre trabalhei muito com radiologia geral, apesar de me dedicar a algumas subespecialidades, mas sempre radiologia geral. Sempre tive contato com residentes, e isso ajuda muito a quem é mais sênior. Eu não estou falando na perspectiva de alguém que está terminando a residência, estou falando de alguém que já estava no mercado há uns 15 anos. E isso ajuda demais. Quando eu fiz a prova, eu achei a prova muito bem feita, tinha as questões simuladas, e realmente foi muito interessante. O meu histórico é de sempre estudar na língua inglesa. Tudo que eu pude, eu sempre estudei na língua inglesa, todo o conteúdo, porque é a língua da medicina internacional. E na radiologia não é diferente. Então, isso ajuda muito. Para quem vai fazer a prova, eu acho que é importante você tentar laudar em inglês. Primeiro, ver como você lauda em inglês, para você mesmo, e comparar isso com os padrões, os exemplos disponíveis. Eu acho isso para você começar a perder esse medo, porque é muito técnico. A gente consegue, mesmo o português, que é uma língua diferente, bem diferente, como o material está disponível, a gente consegue treinar assim. Isso ajudaria muito. O diploma tem prestígio. O Reino Unido, que é onde eu estou agora, não faz parte daqueles países mencionados, mas isso certamente, eu acho que em qualquer país, como acho que o Gustavo já mencionou, é um diferencial no currículo de cada um. Isso perante uma vaga, isso mostra que você se dedica e você está disposto a passar por uma certificação de alto nível como é o EDiR. E para quem tem interesse de ir para fora, em algum outro país europeu que reconheça, isso abre muitas portas. Abre muitas, muitas portas. É uma maneira, já que o nosso título não tem essa certificação, essa acreditação aqui na Europa, mas o EDiR é excelente para isso. E isso foi um diferencial também ao conquistar a vaga que eu me propus a vir aqui para o Reino Unido. E o principal desse diploma também, para mim, foi o estímulo de que, apesar de já estar no mercado há muito tempo, de que eu tinha condições de fazer os exames aqui do Reino Unido. Então foi muito bom, porque isso me motivou muito. E deu tudo certo.
Muito legal essa perspectiva, Simon. E parabéns a todos vocês aí que já passaram, né, por essa prova. Vou passar de novo a palavra para você, Baroni.
Obrigado, Maurício. Obrigado, Breno, Carol. Obrigado pelas palavras. Carol, que bom que eu contribuí para a sua formação, assim como você mesma teve uma carreira brilhante aqui, depois fora. Gustavo, Simon. Eu queria fazer agora um fechamento da nossa parte aqui em português, reforçando a importância que o Diploma Europeu de Radiologia ganhou no mundo todo. Claro que já era muito reconhecido na Europa, mas ele agora é reconhecido mundo afora e cada vez mais no Brasil. Os grandes centros têm valorizado na hora de contratar, reter e promover radiologistas como uma prova de validação de conhecimento e de reforço curricular. Isso é muito importante. Isso vale para radiologistas já com título de especialista aqui no Brasil ou não, que ainda no mesmo processo da obtenção do título, lembrando que ao final de 4 anos de formação, já tendo comprovado o treinamento, ele pode aplicar para o diploma. Então, a gente precisa deixar claro que você pode fazer essa prova logo após a sua formação e a sua especialização em radiologia, muitas vezes concomitante ao título de especialista. Isso é muito importante e ele tem um grande valor na hora de você buscar um crescimento profissional. E claro, como o Simon falou, quando você tem intenção de sair do Brasil, como tem acontecido com muitos radiologistas, ele tem um valor já estabelecido do ponto de vista de board, né, de certificação de título de especialista. Então, isso é imprescindível, é importantíssimo que vocês saibam, e convidá-los a todos, então, para aproveitar as condições especiais que foram colocadas aqui, tanto no chat quanto no início da sessão, o que inclui o treinamento, a prova teste e tudo mais, e entrar em contato conosco em caso de dúvidas, relembrando que a prova acontece no dia 18 de setembro, quinta-feira de manhã, em Curitiba. Muito obrigado mais uma vez a toda a equipe do EDiR, a professora Oleaga, a todo o time que já tem estado conosco nessa parceria agora que chega ao seu 3º ano. Muito obrigado.
Okay, so thank you very much for this testimonials and for your collaboration, and I hope our collaboration continues to grow. And the only thing I have to say is that I encourage all the possible candidates to register for the examination during the Radiological Congress in Brazilian Radiological Congress. This is a great opportunity for all the Brazilian radiologists. And I believe that also some of the young radiologists already mentioned, taking and having the diploma demonstrates commitment and professional attitude with radiology as well. And I think this is very important for our profession.
Acho que encerramos então, né? Então agradeço também a todos e tenham todos aí um bom dia. Obrigado, doutora Laura.
Obrigado pelo convite.
Simon.
Muito obrigado.
Obrigada. Obrigada.
Obrigado, graças.
Tudo
Bye, bye.
obrigado.
Bye.
Tchau.